palpate on your back. Okay?
Yeah.
No tenderness. Not attached to the skin.
You know, Selma, I'm really sorry because the recording just started now. I think me and Muhammad we forgot. It can start from the beginning.
Okay, no problem.
Yes, let's start. Hajar, sorry. Yeah.
Start now.
Yes.
Good evening. My name is Dr. Selma, one of the surgical doctors. Can I confirm your name and age, please?
Good evening, doctor. My name is John. I'm 55-year-old.
Nice to meet you, Mr. John. I understand you have a lump in your back.
Yes. And it does give me a lot of trouble, doctor.
Sorry for that, Mr. John. I would like to examine this lump. The examination includes look, feel, and special test.
Yeah.
Did this
Yeah, that's
please
fine.
you? Okay, Mr. John, you need any chaperone to attend this examination?
No.
Ali, close your camera to see Salma clearly.
So I would like you to
Yes.
in the upper back to the right shoulder. There is no skin changes, no redness, no scar, and it's about 4 by 3 centimeter. Now, Mr. John, I'm gonna palpate you.
Okay.
If you feel anything, please tell me. Okay?
Yeah, that's fine.
Normal temperature. No superficial tenderness. Small surface, soft in consistency, and regular edge. It's slippery, not attached to the skin. Mr. John, just shrug your shoulder.
Yeah, I did.
Not attached to the underlying muscles. Mr. John, this is the tape, and I would like just to measure the size of this lump.
Yeah, that's okay.
It is 3 by 3 centimeter. Not fluctuant. I would like now to switch off the lights to do the transillumination test.
Okay.
Not transilluminate. Now, Mr. John, I would like to palpate your axilla and your neck or lymph node.
Okay.
Then I examine and his 3 lymph groups in the axilla.
Okay, can you do that on the below? Can you palpate for my lymph node in general? Can you tell me? Can you walk through how you're gonna palpate for the lymph node? Which lymph node you're gonna palpate?
Myself?
On the below, while you're talking, which lymph node you're gonna palpate?
Okay. Mr. John, I would like to palpate your neck. Start from the anterior to the ear, through the anterior triangle, then the posterior triangle, then the supraclavicular.
All right. You still have 2 minutes from the 6th unit, from the 6 minutes. Do you want to do anything else before we go to the discussion?
To do auscultation for any bruit.
Okay. Do you have a stethoscope? Can you bring your stethoscope and do the auscultation?
I have no stethoscope, but I can imagine that I have
Yes.
stethoscope. It's in the lung and auscultates.
All right.
For any.
Good.
I forget the palpation to make sure this lump reducible or compressible.
Okay.
It is not reducible.
Good. Anything else?
Also, auxiliary lymph
All right.
nodes also.
Good.
Mr. John,
Thank
do you
you.
need me to assist you in readdress?
No. I'm fine. I can do that. Don't worry.
Thank you for you are cooperating with me. Thank you.
Okay. Thank you, doctor. Can you present your patient?
Selma.
Yes, I examined Mr. John, 55 years old, has back lump.
Yeah.
The lump is in his upper back to the right shoulder. It's 3 by 3 centimeter, smooth surface, regular edge, and soft in consistency. It is not attached to the skin or underlying structures. There is no skin changes, no scar, no sign of inflammation, and
Okay.
it is slippery, not fluctuant. Okay.
That's fine. That's okay. What is your main differential diagnosis?
My main differential diagnosis is lipoma.
Lipoma. Okay. What's your differential diagnosis?
My differential diagnosis, sebaceous cyst.
Sebaceous cyst, and what differentiates sebaceous cyst from lipoma? Do you know?
Sebaceous cyst has a punctum, and if it's turned, it's gonna be a little tender.
Yeah. And what's your other differential?
Other differential, it's maybe tumor, one tumor, because it is near to the shoulder. Yeah.
Yes.
Maybe tumor. Maybe liposarcoma.
Okay. What else? What else? Could it be abscess?
Yeah, it could be an abscess or infected sebaceous.
Okay. What is lipoma?
Lipoma is a benign tumor of the adipose tissue.
Yeah.
It is the most common benign tumor in the adulthood, and it is classified according to my to morphology to lipoma, neurofibroma, fibrolipoma, and
Spindle cell lipoma.
spindle cell lipoma. Yes.
How to differentiate lipoma from sebaceous cyst? You just say now.
And tenderness, yes.
Okay. And
lipoma slippery.
sorry. And sebaceous cyst.
Sebaceous cyst, punctum, and tenderness.
All right. Can a lipoma become a malignancy?
Yeah, it could be malignant.
All right. Why can't you find lipoma?
Lipoma in the sole, in the palm.
Yeah.
In the back, in everywhere in the body. But
No. Why can't you find lipoma? Where are the places that has no lipoma on it? In it?
In the sole, in the palm.
What else? You said sole and palms. What else? Okay. What are the location of dangerous lipoma and why?
Dangerous lipoma in the small intestine, intraperitoneum.
Yeah.
It can cause intussusception or intestinal obstruction.
Yeah.
In the spinal cord, it can cause
Time
compression.
finished. Time finished. But we're going to continue. Yes, continue.
Paraplegia. And in the focal cord, suffocation. It can cause suffocation.
What else? Yes. How will you investigate this patient?
First, I will start by soft tissue ultrasound.
Yeah.
If it has deep extension not figured out by ultrasound, I will go to CT or MRI. Then I will do excisional biopsy.
Incisional biopsy. All right. Fine. How will you treat your patient?
I will treat him by surgical excision of the lump under
Yeah.
local anesthesia or by regional block or general anesthesia, according to the sites and size and anesthetist.
Okay. All right. How should the anesthesia be determined?
It could be local anesthesia, just infiltration around the lipoma, or
Yeah.
regional block.
You said original block or regional block. You said local anesthesia, regional block. What else?
Regional block and general anesthesia.
All right. And how will you determine which type of the anesthesia you're going to use?
I will discuss with the anesthetist,
Yes.
and also I will involve my patient in the. I take the patient opinion if he can tolerate, and the lipoma is small in size. I just will take it by local anesthesia.
Okay. Good. Good, Salma. Good history. Good examination. You did very well. I do have a couple of points. Firstly, I like you didn't forget to thank your patient at the end. You didn't forget to expose, which is very good. You asked, do you feel any pain before you touch the patient, which is very good technique. But you said it's not trans-illuminate. Is lipoma, does lipoma illuminate or no? I'm asking you, Sam.
I think no. يعني transformation cystic if there is fluid, and lipoma contain fats.
Correct.
Yes, lipoma and ganglion cells does not and ganglion do not trans-illuminate.
Yes.
I was about to say you forgot auscultation, but you remembered it at the end. But why you delayed the auscultation later on? Did you forget it? I think you forget it for.
Yes,
Yeah, you forgot it. You forgot it for a couple of minutes and then you remembered it. You thanked your patient at the end. You forgot abscess you forgot abscess as a differential diagnosis.
Yes.
When I asked you could it be malignant, you said yes. That's not the right answer. You should say rarely. Rarely. Yeah, it's very like.
Yes, but in rare cases.
Yes, you should not. Don't say yes. Say very rarely, because yeah, most of the surgeons have the idea that lipoma will never ever be a cancer. So it's better to say very rarely. That's the answer. Okay.
Okay.
The anesthesia. When I ask you how will you determine the anesthesia, the right answer is to say, I will check with the anesthetist. Right, that's right. But also according to the size and according to the number of lipoma and the location. So you have the location, the size, and the numbers.
Okay.
These are the factors that will determine the type of anesthesia. And the last decision is in the anesthesia hand, not your hand or not your patient hand.
Yeah.
It's a decision that will be taken by the anesthetist. Okay. And you studied it from school, obviously, right?
Yes.
And you saw the pictures of sebaceous cyst in the school.
Yes, has a punctum and redness.
Yeah. Okay, I'm just making sure. That's fine. Muhammad?
Selma, you did very good. I think Ali covered all points, but I would like to ask you, did you do the inspection as look into any side, any scar? I think you go quickly through the inspection.
Yeah, she did it.
In the first, I go slowly, I inspect, but when we repeat after recording, I just make it in hurry.
Yes.
Yeah.
Now, also about the maneuver of the fluctuation test. I think you did it. You didn't do it right. Cross fluctuation test.
I put my fingers at thumb, middle, beside the lipoma, and by the index, I press in the center.
Yes, this is one of the maneuver of the fluctuation test. Also,
Yes.
I would like to comment
Just make
about
sure
the
you do it right.
explaining during examination, as the consistency is the fair is about 3-4. I think they are I said that in the previous station. There are some examiner not explaining during examination to the examiner, but to the stimulator, it's okay.
Do you understand this point? So while you are examining your patient,
Can I tell to the actor that I feel this lump is soft and has regular كده.
yes, you can do that, and don't over explain. Don't
Yes.
over explain, and don't explain everything. You know what I mean? So you just do it in a way that you don't annoy the examiner or the patient. Don't be very, very, very talkative. Okay? Don't give the examiner a headache. You explain a bit. For example, hello, Mr. As you did now. Okay, I'm examining your lump now, Mr. John. I'm doing a specific test to see the consistency of the lump, and then you don't say the size is 3.3 and it's transilluminated. Not attached to the skin, no inflammation. You just say a couple of points to the patient. Your examiner already knows what.
Yes. Ali.
Okay,
Also, Salma, I have two last point, which is how to measure the lump. You need to measure the lump by a tape.
In
In
two
the exam room,
dimensions.
in the exam room, you will find the tape to measure the lump.
Yeah, she
If
brought
you
her tape,
didn't
by the way.
found the tape, you can measure it by your fingers. The
Yeah,
last
she brought her
point,
tape.
I would like
She
to
brought her
complete.
tape, Muhammad.
All right. The last point is about to complete my examination by check is there any lump in other side of our his body or not.
Okay.
All right.
And Salma, be fast. We didn't finish within the time, so you need to speak faster, so you can
Inshallah.
finish with the time. You have all the knowledge in your head. You just need to practice more and speak faster and faster.
Inshallah.
The
Thank
next
you.
station, thank you,
Good.
is what's the next station?
Varicose vein, Muhammad Kamal.
I think he didn't arrive
Right?
to his home. He told us he will driving now. Muhammad Kamal. Are you
Muhammad Kamal,
unmute
Hello?
yourself, please?
Yes.
are you home?
Now
Or is-
I am home, and this is your friend. You can see him now.
Okay.
Omar. Omar.
That's my other friend. The photo see this my other friend.
Okay. Let's start then.
Okay, just let me set the camera. Okay. Whenever you say start, okay.
Yes.
I
Let me
start?
put the timer. Yes, start.
I think you need
Start,
to
yes.
start, Muhammad.
Hello, mister. My name is Dr. Kamal. I'm the vascular surgery follow up here. Surgery follow there. Would you please confirm your name and date of birth, please, for me?
My name is Edward and my age is 6 years old.
Okay, Mr. Edward, nice to meet you. Okay, how can I help you today?
I have dilated veins on my leg.
Okay, today I'm going to do an examination for you, some tests, including looking, feeling, and do some special tests for you. Is that okay with you? Would you please stand up for me a little bit here? All right, we'll go first. We're gonna look at for your abdomen and your lower limb, and you can see there is dilated veins, and you can see, okay, there is no edema, no scar change, no varicosities, no multidrink concentration, no previous surgery, no other scars on the abdomen here and on the thorax. All right.
تبارك الله.
First of all, you have chaperone. You need chaperone, and we'll examine you, and we will maintain your dignity. Is it okay with you?
Yes.
Okay, thanks so much. Right. Would you please lie down here, please? Okay, would you look here? Now, when we do palpation for the patient, when you see here any temperature, any tenderness, you have tenderness here, pain here. Okay, little discomfort. Right. And palpable thrill. And we'll do cough impulse. Could you please do cough for me? Okay, there is no cough impulse. And the other side. Okay. Okay, Mr. Edward. Now we're gonna do some special tests. Is that okay with you? There is two tests we're gonna do it for you. The one is the Brody triangle test. First of all, we're gonna elevate the leg here. We're gonna reduce the vein and fulfill the vein. It is free. We'll make the vein empty. We're gonna use tourniquet. After we make the vein free, empty, right? After we use the tourniquet, we're gonna just remove the tourniquet. We move the foot down. There is refilling for the veins again. And the other test, this is the perfect test. After we make the veins empty, we use a tourniquet. After that, for a while, we're gonna see a repeated tip 2 test. And again, we have to remove the tourniquet for a while, a minute. We can see there is refilling again of this veins, okay? Now, mister, do you feel any discomfort here? Okay, a little bit, okay, so sorry. After that, we're gonna use handheld Doppler for you. We're gonna see how there is venous, how the mapping of your venous, okay? This is handheld, 45 degree, put it here in the subvenous connection, and after calf compression, wanna listen to the sound of the handheld. Okay, this sound, you can see there is some kind of elongation, swoosh sound, which means that maybe venous problem. Okay. Okay, Mr. Edward, can you please take your clothes back again? Okay. Thanks so much. I appreciate your work. Thank you. Finish my examination.
Thank you. Good. Can you present your patient, please?
Okay, by Mr. Edward, I will present now. I will examine now my friend, Mr. Edward. He is 6-year-old, and he have dilated face down the stair, and there is examination for him. There is tenderness, and there is swelling. It's of inverse connection. There is we do examine for him. There is no scar change, but there is edema, which indicate venous hypertension and venous insufficiency.
All right. And what are the causes of the varicose vein?
In such a case, yes, there's many causes. There's varicose vein could be a biological and predisposing factor, as common in age, wear and tear, more age patient common happen to him, and could be due to gender, common in females, hormonal abnormality, or family predisposition in the family, running in families. Could be due to hormonal change, which from menopausal period, or taken birth contraceptive pills, and also due to environmental factor, lifestyle factor, that one who said doesn't work, lack of physical activity, and also due to obesity, which is due to chronic compression on the veins.
And prolonged standing.
Prolonged standing, yes, of course, yes. Prolonged standing, which means that chronic compression on the veins and lead to valve insufficiency.
Good. How important is Doppler assessment in your plan?
And Doppler assists us for the mapping of the veins, for invasive technique, and for assessing of the valvular insufficiency and valve of the veins insufficiency, and also in assessing the chronicity of the vein.
All right.
Vein problem.
What's your plan? What's your management plan?
First of all, we can do conservative management. This conservative management means we have to change the lifestyle. We have to reduce the weight if there is obesity. We have to increase the movement. We have to elevate the leg for reducing the edema and swelling. And we have to treat the predisposing factor.
Okay. And what your definitive management?
It's sorry, either it's invasive non-operative or invasive operative. If it is invasive non-operative, we can use sclerotherapy. Sclerotherapy point for sclerosing the dilated veins. We can use ablation by using the laser. We can use. I also there is sorry for recapping. For conservative, you can use compression stocks for the vein.
All right.
For the limb itself.
Okay.
For invasive non-operative, yes, sclerosing, laser ablation. There's other two options. Forget about.
Okay. Fine.
And there is a thermal ablation. For invasive operative, we're gonna do a surgical operation, small cut, taking this phlebotomy is this evulsive vein and close the suture with the compression
Banding.
band.
All right. What are the contraindications of stripping the veins?
Thrombophlebitis or deep venous obstruction, system obstruction.
All right. Is your patient taking OCP? If your patient is taking OCP, what do you think?
This may predispose. Sorry, this means that it will affect his condition, and this may prolong the procedure and deep venous problem.
Good, Mohammed. Done.
Sorry, I have
You still have 35 seconds. Very good presentation. It wasn't an easy one. Your performance is very good. Your examination is very fine. Do you have you?
Yes, yes.
Look, it's a pass, but the small point
Yes.
we need to recap it.
Actually, I'm trying, sorry, there is no video in the school. Thanks, guys. Thanks. No videos on the school. I'm trying to open the net. That's why, you know, sometimes there is. That's why I will need your comment.
Yeah, that's fine. Do you have any? I'm not sure if you asked about any pain before you touch him.
Yes.
But did you ask if you have any pain before you touch him? Muhammad.
Yes, to be honest with you, I didn't ask. Yes, number one.
Yes. Yeah. You know, when you do the tourniquet, it's not. That's why we need Muhammad videos. We're gonna publish them very soon. When you do the tourniquet, you take the legs, you refill the vein as you did. You with the tourniquet, but you ask your patient to stand up. So
that's why.
Yeah. After you do that, you tell him, okay, stand up now for me. So you will use the gravity. You use the
relieve
gravity.
the tourniquet.
Yes,
yeah.
after releasing the tourniquets.
Yeah, you don't relieve the tourniquet while the patient is lying flat. You relieve it while the patient is standing.
Good.
Okay.
Good.
That's why, Muhammad, we need your videos.
Yes.
We need your videos.
Muhammad.
Yes.
Yes.
Yes. Remove it while standing. Yes. You said I examined my friend. I cannot say that's wrong, but it's better not to say that in the exam. You don't say I examined my friend.
I think he's joking with us.
No, actually,
No.
actually, because my children, they were eager that they want to get out. That's why I'm trying.
That's fine. That's okay. But we're trying our best to make it same way as the exam. We put the timer, everything.
Sorry.
When you are presenting, say I examined this gentleman. Don't say my friend.
Okay. Appreciate
Okay. Ali, you have any point?
That's all my point.
Muhammad Kamal?
No, that's all.
Yes.
Excellent performance. Just I will go quickly through the examination. You introduce yourself. Just in inspection, you need to look to the patient from behind, as you need to look to the short saphenous vein. In front,
Okay.
Yes. Impalpation, you check the temperature, I think in the side just. Also, check
yes,
it in the
trying
legs.
in the abdomen, in the thigh, abdomen and thigh.
And legs, which is found greater
Okay.
saphenous vein and short. Okay.
Good.
Also, I think this is not written in the school, but we will add it. Check for hand hold Doppler while patient is standing. Because
Not written in the school set.
Yes, I'm really
Not
sorry.
written,
I'm
yes.
really sorry for that. Because you need to squeeze the muscle, the calf of the patient.
Written
if
in the
it's-
school, 45 degree, use handheld.
Yes,
to the
I
sound
apologize
during
for that. I apologize
No.
for that, Muhammad.
Wait, Muhammad. Wait. the hand Doppler 45 degree is the angle of the Doppler.
Yes.
But the detail of the patient is standing.
Because you need to
written, but-
squeeze the calf muscle. If the patient is
No,
in
yeah,
a
yeah,
supine
yeah,
position,
squeeze it,
you
yes.
will not able to squeeze the
Okay,
calf
can
muscle.
you give me a minute?
Okay.
Can you give me a minute, please?
Okay.
So imagine if I'm standing like this way, and this is my handheld Doppler. The 45 degree is the handheld Doppler. You don't put it 90 degree, you put it 45, you use it every day. I'm gonna add now while the patient is standing.
Yes.
All right?
And the last point about the special test, which I did mention, you need to ask the patient to stand after for Berger test. You need to, the multi-tourniquet test. It is not necessary, even you didn't found there is saphenofemoral incompetence. Just do the Berger test.
What is another? There is Brody Trendenberg.
I
Hello?
think.
Hello.
Hello.
There is what's Berger test, sir? Because not written in.
No, Berthas test, Berthas maneuver.
Berthas, yes, I hear it Berger.
No,
that's why.
I mean Trendenberg test.
Okay. That's why I hear it Berger.
Yes, I'm really
That's
sorry.
why.
Trendenberg test. Ask the patient to stand, and the Berth test, which is a multi-tourniquet test. You don't need to do
Okay.
unless you didn't find the where is the saphenofemoral incompetence, because
Good.
you need to determine that.
All right.
Right. Overall, you did very good. Thank you.
No, very, very, very good. Very good performance.
Yes.
I think everyone today did a very good job, by the way. That's a very good performance.
Can I ask a question, or we've already?
I forget point, Muhammad Kamal, which is the crucial.
Yes.
The palpation. You need to palpate
Yes.
the greater saphenous vein and short saphenous vein.
The greater saphenous vein in the medial malleolus, whole of the thumb, of the femur
Yes.
and leg,
Yes.
whole and the short saphenous lateral malleolus
until
the leg?
reach to the femoral artery, and then medial to the femoral artery, you will find the femoral saphenous junction, and then put your finger and ask the patient to cough. It will
Would
go
you
smoothly.
Please make these details more in
Okay.
in school, because yes, this is a crucial
I
point.
will
Yes.
also upload video, inshallah.
Ibrahim
Okay, what
asked,
about
Ibrahim,
what's next?
did you see the picture of the Safina Varix, Muhammad?
Saphenous varix, what picture? There is only one picture in the school.
No. There's two pictures. When the last time you reviewed it?
Now, when you are right, there is one in the.
One in the beginning.
No, there is the one in the beginning as the Safina Varix picture, and also there is a table. Were you able to see all of this?
Table?
I just want to make sure it's published.
Nothing here. Nothing in the system.
Time
What? This is the school I can.
Here, let me show you. Give me a second.
Okay, you can open it from your
This
side.
picture, did you see it?
Yes. I actually, because I have print the paper through my scanner with the not color. That's why I have seen it. Yes.
Yeah. So when you palpate all over. You go from down there. You reach.
That means that I will take this. I will type it again with the color. I have seen this picture. Yes, you are absolutely right.
So you start from down there. You reach till here. That this area is close to growing. This immediately lower to the growing.
and ask the patient to cough.
Okay.
Yeah.
Actually,
close
this picture actually I didn't understand it like that. That's why.
Yeah.
Because
All right.
that's why I asked him to cough, but I didn't understand it.
Yeah, we're trying our best to make the school very clear, but it will not be clear without some explanation. That's why. It does need practice. It does need practice and explanation.
The next station.
Yes. Okay, we're finished.
I think we finished.
Nobody-
Or thyroid.
No, you are
thyroid
finished,
we did.
Dr. Muhammad and Dr. Ali, from your comment, because
Yeah,
there
I
is a
think
question.
so. I think so. Yes.
Do you have anything to add?
Sahar is not participating today. So look, no. I want someone to help me, please. I
Okay.
want to prepare for the next session from now. Okay.
That's why this is my question.
Yes. Let's prepare to the next session from now. First station, arteriovenous fistula examination, I want you to write your name and if you want to do it, and then
You want to write it now in the
yes,
chat or in
right.
the
in the group,
Hagir,
in the group of
Hagir
Hagir.
will do
Okay.
arteriovenous fistula.
Okay.
And Ibrahim will do peripheral lower limb arterial examination.
Okay. So these both are done.
Yes.
I'm sorry to interrupt. I supposed to do AV fistula today.
Who is it?
Asia?
Asia. Yes.
Oh. All right.
So Ali,
okay.
put a timer.
Let's
and
do
we
it
will
today
start
then.
now.
I thought we finished Asia. I thought we finished
That's
today.
why I'm asking.
It's no problem if you want to postpone it, because AV fistula is such a mess. I can't find any video to guide me well in it. I need your help.
You will do it now.
Let's do it
because
now. I thought, yeah, I'm glad you talked. I'm glad you let us know. Because we were just about to, we thought nobody took it.
No,
Okay,
I
put a
didn't.
timer, Ali.
I put it now. Let's start. It said start. Yeah.
Okay. There's no patient, of course.
Yeah,
I'm
I'm
going to
your
start
patient.
by
No, Sahar, why try to examine? You know what? No, okay. Can you bring anything? Let's say a stethoscope. Bring a stethoscope and act. It's like your
don't have one.
arteriovenous fistula. If you have arteriovenous fistula,
But what I'm going
bring
to
anything that you can practice on.
maybe I can just act with my hand, or how?
Probably.
Okay.
We want to make it
It will be difficult for your hand because there are special tests you need to use your both hands.
Okay. Can you bring anything? Can you bring any circular, any stuff, any material?
Ball.
Stethoscope.
But I know I can bring something circular, but something circular I cannot do the special test with.
You can do the special test with. Let's say palpation, auscultation.
Yes, palpation, auscultation, but not like the augmentation test and the arm lift test.
Okay.
Yeah,
use your
but
hand. Use your hand. Ali, let her use her hand. No problem.
Yeah. Look, Sahar. Our point is we want to make it closer to the exam. We want to make it very close to the exam, as close as we can.
Yeah, that's why I asked in the school if it can be done verbally or not, and you say no problem.
Yeah, but bring any material and then practice on it.
It's
anything
like a wire, anything like a wire.
Any wire, whatever. Yes.
Okay. Can this work?
Yes, it will work. Let's
I
start.
don't know how I'm going to activate it. Okay. Just a minute. Okay. I'm going to enter the room, greet the examiner, wash my hands.
Ali, put the timer.
Dr.
Yeah, I put it already. Hello, doctor.
My name is Dr. Asia Abdullah, one of the surgical doctor here today. Today, I've been asked to examine your right arm and hand as well. This is going to involve me looking, feeling, moving your arm a little bit and do some special test. Will this be okay with you?
Yeah, doctor, that's fine. Yeah.
Okay. In order for me to do a better assessment for you, I will need to expose all of your upper limb and your upper chest. Will this be fine with you?
Yeah, that's okay. I'm gonna expose it now.
Do you need? Okay. Do you need any chaperone?
No, it's fine.
Okay. Before beginning, I need to ask you if you have any pain.
Yes, I have pain on my arm. I just wanted to be very careful while you are touching it.
Yes, I'm going to try to be as gentle as as possible. Whenever you feel pain, just let me know and I'm going to stop. If you need painkiller, just let me know, okay?
All right.
Okay, I'm going to start by looking for your hand.
Okay.
I'm going to look for a redness, a pallor, a cyanosis, if there is a clubbing, if there is any muscle wasting, And then I'm going to look for the forearm if there is any localized swelling or generalized swelling that can indicate a central venous obstruction. I'm going to look at the fistula site if there is any hematoma, if there's the side, the size, the skin overlying the surface, and any previous sites of fistula as well.
Okay.
Then I'm going to I have to do some movement with your hand. I'm going to elevate your hand up your chest like
Yeah.
this. Okay. I'm sorry. Do you have any pain in your shoulder?
Yeah, I told the doctor already I have pain in my shoulder.
Okay. I'm so sorry. Is this causing you any pain?
Yeah.
Okay. I'm going to finish fast. I'm going to observe the fistula. If it's disappeared or it's still consistent. If it's still consistent, that means there is a obstruction or venous stenosis. If it's collapsed, then it's normal. I need you to rest your hand now. Okay, you can rest your arm. Thank you very
I'm glad
much.
you did that. I was already feeling like it was very painful. I didn't know for how
I'm
long
so
you're gonna
sorry.
keep it up there.
Yeah. Are you good now?
Yeah, I'm good now.
Okay. Thank you very much. Then I'm going to palpate in the hand. I'm going to check for the capillary fill time. I'm going to check for the pulse, the radial pulse. If it's weak or absent, or it's normal. If it's not weak or absent, I'm going to use the Doppler scan for it. Then I'm going to palpate for the temperature and the sites of the fistula. I'm going to palpate for temperature and tenderness. And I'm going to use the tip of my fingers to check for the pulse over the fistula. Usually the fistula has no pulse and it's compressible and smooth. Anything other than this indicate abnormality. Then I'm going to use the palm of my hand in the fistula to check for the strain. Usually the strain is continuous. We have the pulse component, the systolic and diastolic. Anything other than this indicate obstruction sites. After this, I'm going to use the stethoscope now. I'm going to hear the swelling side to check for bruit.
Can you do
After
it?
doing
You have
that,
a stethoscope. Can you bring your stethoscope and do the palpation?
I don't have any. I'm sorry.
No problem.
Okay, I'm going to hear it by the other side, the bruit.
Okay.
So I need to hear your chest as well, if you don't mind.
Yeah,
Okay. Okay. Then I have to do some other test in palpation, the augmentation test. I have to compress just proximal to site of the arteriovenous anastomosis and check for the radial pulse presence. If it's positive, then there is definitely a obstruction sites in the fist. After that, okay. Thank you very much. You've been
Thank you,
helpful.
doctor.
I'm sorry if I cause you any pain. In order to complete my examination, I have to check your blood pressure, see your chest X-ray to check for any cervical rib, and also do a full cardiovascular examination as well, and full neurological examination of the upper limb. Thank you very much. Can I help you to redress?
Yeah, please.
Okay. Thank you very much.
Doctor. Can you present your patient?
Okay, my patient presented with a pain in his right upper limb. He has features indicated of a ischemic dialysis ischemic syndrome, which is having a pallor, is having a cold hand, and has a positive augmentation test as well.
All right. And what's your differential diagnosis?
Other different monomilic neuropathy.
And how do you differentiate between the two?
Okay, by examination, I'm going to find in the hand a hand change such as pale, coldness, and also I'm going to find a weak pulse or absent pulse.
Which in which? Which in which? Can you tell me like the coldness and
in the hand, the affected hand? What do you mean?
Which one is dialysis ischemic stroke syndrome and which one is ischemic monomelic neuropathy?
This is in the dialysis ischemic syndrome, not the neuropathy.
Can you compare both
Yes,
of them? Can you
okay.
tell me in this I will find this and
Hand of the neuropathy is going to be red and warm and has a paresthesia and numbness, and also sorry, just a minute. I'm so sorry. In the neuropathy, there's going to be a numbness, and in the numbness, absent pulse, the pulse is going to be intact in the neuropathy.
Okay. How will you investigate your patient?
Yeah. And
Patient, if he has the ischemic one,
I'm going to
good
do
diagnosis.
a modification of the fistula by a surgical revision or approximation of the site of the fistula, or maybe a I cannot.
And Egyptians, it is not the medical base what we are trying
because
to make it.
I don't know if
I totally agree with
royal
you.
correct.
Means nothing.
That's why I asked for your videos.
Okay. So
Yes, please, yes. Ask for the videos. Let's teach empirical videos.
we will make this priority. We will create a video
Yes, thank you very
on
much.
this one.
Ali,
Okay,
I think
so,
I have poor internet
Good
connection.
presentation. Yeah,
I just wanted to comment first because I have
it's okay.
poor.
It's okay.
Asia, you did very good, excellent. Just I will go through
Okay.
quick through this
Yes.
examination, introduce yourself, and you take permission.
But you know, I have many questions. I need. Okay. Yes.
Make it later, please. In inspection, you inspect the fistula.
Yeah.
Just you need to check in the palpation. You need to check the temperature for both hands, not just
Yes,
the
that's
side of
one
the
of my
fistula.
questions. Yes, thank
Yes.
you.
And also in palpation, I think you forget the direction of the flow.
Yes, yes.
The
Okay.
important point here. In auscultation, you auscultate the fistula and the heart, and you did the special test, which is the augmentation test and elevation arm test. That all point I have.
Okay. I have quick points. You didn't ask me about my name. You didn't
I
ask
didn't
me
say
about
can
my
I
name.
confirm? Oh, that's why I couldn't remember your name. Okay.
And
Okay.
He's right. He's right. He's right. He didn't ask about his name.
and,
Yes, that's why I couldn't remember.
this look, you know, okay. Some you may enter a station and you think you did great,
Have a patent
and your
inspection.
examiner who's evaluating you, he's just upset with you because you didn't ask about your patient name.
Hopefully not.
So you didn't ask about my name, and thus you were not communicating with me during the station. You asked me a couple of questions, but it wasn't sympathetic. You just ordering me. So please don't forget the basics. Don't forget the basics.
Okay.
Name, consent.
Okay.
These are the basics. I'm glad you asked about the
Okay.
elevation. I think you over-explained. You were like, yes, you
Yes,
were like
I'm
someone
just
who is.
I have poor internet connection.
Like what's the word? Who's reciting?
Yes,
You were like.
it was for you to correct me. Not, I'm
Yeah.
not going to do it. In the
That's
exhibition,
fine.
yeah.
As
Yes.
Ali?
But when you practice yourself next time and you record yourself, that's what I advise everyone: record yourself. Try, okay, Mr. Jones, without over explaining. Revise this video later on. Yeah, Muhammad, let me finish my point.
Okay. Continue, Ali.
Mhm.
Are you with me?
Yes, continue.
Yeah. So, try not to over explain yourself. You said to complete my test, to complete my exam before you present your patient, right? So when the examiner asks you present your patient, you'll say, I examined this patient and I found this and this and this and this. To complete my examination, I will do this and
Oh,
this and this. You said it,
okay. I didn't know that I am going to say it before, after.
yeah, you said it before that.
Okay.
Yeah, say the presentation and then say I'm going to complete my examination by doing that and that and that.
I'm sorry, even if I had time and I can wait to present my case
No,
and then
no. It's not like you have to wait. It's positives and negatives. When you present if you have like 1 minute remaining, mention it now. Probably you need.
yes. So I say, in order to complete my examination, I have to do the blood pressure.
Yeah, it doesn't matter that much. But for me, and the way after I present, then I will do to complete my examination. You finish earlier and you still have 1 minute. You can mention it now, but it's not a big point. But you should mention to complete my examination, I will do this and that, and you have to say that. Before or after, it doesn't matter too much, but not mentioning reduce. But overall, good presentation. Very positive.
The
Are
last
we
3
finished?
points,
Because I have
Asia.
one question.
The last 3 points,
Thank you very much.
which about the pulse, checking the pulse. You need to check the radial and ulnar pulse and brachial artery and axillary, and offer a handheld Doppler if you miss the pulse. Also, in elevating arm test, ask the patient to elevate his hand. Don't elevate by yourself. Could you please elevate your right hand?
Yeah.
Right? That's all of my point.
Okay. Can I ask?
Okay.
Yes.
Okay, when I do the temperature, do I do it all over the limb or in a specific time or site or when to compare, just to compare both of the upper limb and all over the upper limb?
No.
No, look. The way we did it, I'm doing vascular now.
At the
Let's say we have a brachial. Let's say we have someone who has arteriovenous fistula rupture or who has brachial, brachial artery aneurysm or whatever. You just touch here, here, and here, like 3 points. It doesn't cost you anything to do that.
First at the fistula, yes.
Yeah, so you just show especially for your exam, you touch here, here, and here. Here, here, and here, real quick. It will not cost you more than 10 seconds. So it's not a big issue.
So this is the only test where I compare.
Yes.
Okay.
No,
I don't have to compare the pulse in both hands.
No, just for the hand with the fistula.
The involved one. Okay.
Yes.
but let's say if you compare, let's say if you take the other one, you will lose nothing.
Maybe he has weak pulse in general.
Yeah, if you take the other one, you will not lose nothing. If you take that,
Okay.
so take both. Take both,
Okay.
just for the sake of completion, and it will not cost you more than 10 seconds to take both of them. Right?
Okay. And should I do the hammer pulse or this pulse like when we raise the hands? Should I do it?
No.
The hammer pulse.
No.
The
No.
collapsing pulse, you mean? For
Yes.
aortic regurgitation.
The water hammer. Yes.
You don't need to do it, Asia.
No. Why? Why?
I found it somewhere that's they do it. I don't know why.
No. There's no.
No.
Look.
No need to do
It's
it.
a fistula.
No. Okay.
It's about it's a fistula. You should be very careful when you are dealing with the fistula. Don't ever do this. Don't ever raise it way very harshly.
Okay.
Okay?
Okay.
You're gonna rupture it in the exam, especially if it was a real one. That's not a good thing to do, to be honest. Don't do that.
Yes, Dr. Ali,
Be
would
very
you please,
gentle while you examine the fistula. Yeah.
this point, can you please say it again? What do you mean by elevate the hand? Sorry, because I didn't understand it. Sorry.
Okay. So in the fistula, you just ask your patient to elevate his hand himself. You don't elevate it yourself. You ask, do you have any pain? And then you ask him, can you elevate your hand or no?
It's called
Why?
elevate
Because you
arm
want to see if there is any obstruction or no. If there is obstruction, it's going to be
Yeah.
bumped out, and you can see it's getting bigger. Why? Because he rests his hand and the fistula is already blocked. Now the blood is pouring from upside down there using the gravity, but it's obstructed. There is no outflow. That's why it's going to get bigger. So you want to make sure if the fistula is obstructed or no, and that's a simple test to do to make sure it's obstructed or no. The two important points here: you don't do it yourself. You ask your patient if you can do it, if he can do it, and then before he does that, you ask him, "Do you have any severe pain in your shoulder?" And you do that. You will let him do the test regardless, but you just do that to show the examiner that you are caring about the patient and that you are aware of about the pain. Let's say you told him, "Do you have a shoulder pain?" And he said yes. That doesn't mean you will not ask him to raise his hand. You will still ask him to raise his hand, but you will change your sentence. You will say, "Okay, please try to raise your hand.
as you
And
can.
if you felt severe pain, you can stop whenever you like. Just do this slowly." You got the point. So you ask this question to make sure that your examiner sees you and to show the examiner that you are aware that you need to ask about the pain. Asia asked a question, Muhammad, about the cranial nerve or something like that.
No, I
she
choose the
choose
station.
the station.
I choose
Sorry?
it.
All right. No, don't choose here. Choose in the Telegram. Whoever write the first station will take it in the Telegram group. So for the
From
next
the
real
calendar.
quick,
Has to show up.
Just choose from the calendar,
a-
please.
A
yeah.
good
So
they,
we have couple of stations we didn't do today. So we have gynecomastia. Asia already gonna do the gynecomastia and the parotid gland, right, Asia?
No, the parotid is not mine.
What's yours? You have two, right? What
have
are
the-
they?
Yeah, and the AV fistula.
You did the fistula now, right?
Yes.
All right. We are supposed to do some parotid today also, right?
دكتورة
No, the
سحر.
parotid is Sahar.
You're
We
supposed
are
to do
two
the
different-
parotid today, Dr. Ali. And don't forget the diverticulitis. Again, this is missed station 2 weeks ago.
Oh, yeah. That
You said to me, remember you, make me remember.
At the
This is
end
the
no,
of
second
but
the
time.
session.
don't make me remember at the end of the session, Muhammad. As a start, not at the end of the session. Not at the end of the session. I meant as a start. Okay. So look. Quick plan.
Yeah.
There's a couple of stations we didn't do. Please choose from them and write your name for the sessions we didn't do from before, which is acute limb ischemia diverticulitis. Muhammad Kamal just said now.
Okay.
And here,
Parotid gland.
Sahar gonna do the
parotid سحر.
Can we,
Parotid
one of
gland.
us can do
Yes.
more than one session? That's the question, because the
if
priority is
nobody,
the other-
if nobody took it till the day of the session, then you can take more than
Okay,
one.
because the priority for our colleague who are taking the exam. That's why I'm
Yes,
asking.
and that's why we are thinking too.
Yes.
So let's we're gonna finish the meeting now. Let's go to the Telegram group immediately
دكتورة,
and let's arrange who do what
next time what time?
Let's do
In the
that.
school now calendar it's 11 p.m.
In your time, doctor, it's in your time, your country.
So what I'm saying and what I'm gonna say, always the time follows the school. What's written in the school is the time.
The time written in the
11.
school for today, Dr. Ali, it is 8 o'clock. In my King Saudi Arabia, it is 8. You didn't change it. I know that.
Yes. Yes.
I know that.
And for the next one is for the next session is 8. For the all the session next session is 8. If I'm gonna
Can I
change
ask
it, I'm
one
gonna
question?
change it 2 days
Can I ask one?
before.
Okay, can I ask one question? Because the calendar said it's up to 31 of June. And then I don't know, in July there is session or 31 of May. The calendar
No.
is
The calendar is up to 15th of July. Not
because
31.
now it's 31. I didn't open the school now, but I remember that.
No. Look, Muhammad. It's still
Four sessions up to the
this
end
is
of
July,
May.
right?
Okay,
We
next
have our
month you
session
mean?
already
No, I didn't
planned
go to
here.
the next month. I didn't go to the next month.
Yeah.
Okay, I'm opening the
It's all
session
planned.
school now.
Okay.